Do you know that too much of this, it can kill your dog? Poison control gets a ton of calls this time of year about dogs liking too much of this ice melt off their paws. In today's video, we're talking about salt toxicity, the signs and symptoms, most importantly, what you can do about it. It's winter time and there's ice, you spread a bunch of this stuff, you want the ice to melt. The neighbors have had a paintball fight next door. Paintballs are loaded with salt. In the past, we used to talk about inducing vomiting in animals that have been poisoned with salt. That's no longer recommended because of salt toxicity. This is also seen chronically in our animals, and this would be an example of an animal that's been trapped in, say, a garage. And if you go without water for a long enough period of time, you're going to have extremely high blood levels of sodium, signs of salt toxicity. So when your dog has these extremely high levels of sodium in their body and their bloodstream, it actually draws fluid out of the other body cells. Initially, what you're going to see are GI signs: vomiting, diarrhea, although that goes with many other things. Then typically you're also going to see increased drinking, increased urination. That would fit with the dog who's been stepping in the salt, licked his paws, consumed too much salt. And in advanced stages, that's when you can see seizures, coma, and even death. And how much is toxic, you might be wondering, but you'd be surprised just how little it takes. A small 5-pound chihuahua, a little toy breed, as little as 1 teaspoon. This teeny little bit of salt is enough to cause serious salt toxicosis. Your dog's walking around outside, someone sprinkled a whole bunch of salt, your dog's pads are wet, he's got a bunch of that salt stuck to his pads, he can consume enough to cause salt toxicity. If all you're seeing is just some mild GI signs in terms of maybe intermittent vomiting, a little bit of diarrhea, no other weakness, neurologic signs, then likely your dog is going to recover just fine. A couple things you want to do in this situation. Number one, you want to wipe your dog's paws well. Like just wipe up all that excess sodium, just to prevent them from consuming any more of that salt. Then number two, you want to get them to drink as much water as possible, because all that extra fluid, that's going to dilute the blood sodium level, and that's what we're wanting. We want to bring down that sodium level as fast as possible. But if we're starting to deal with neurologic signs, such as weakness, this kind of wobbling, trembling seizures, your dog needs to be seen by a veterinarian as soon as possible. They're going to do a couple things to pretty rapidly bring down the blood sodium level. One, they're going to be doing an IV fluid with minimal amount of sodium, like 0.45% sodium chloride. Secondarily, some type of warm water enemas to once again draw as much sodium out of the body as fast as possible. One last point, don't use activated charcoal. What they're actually finding now is the charcoal will actually maintain the elevated sodium levels. It's not something you want to give for salt toxicity. Then more important, all this is this prevention. Never use sodium to induce vomiting in a dog for a poisoning. You want to be always using this, hydrogen peroxide. And if you are regularly walking your dog outside on the ice and the snow, as we are, get yourself some booties. Just make sure you have a damp cloth. Your dog comes in from being outside, just wipe his paws really well. Then you're not going to be dealing with salt toxicity.